Okay, let's start with today's topic, that is vessels of head and neck. And we have already discussed in the elaborative form in our WhatsApp discussion group about the vessels of the head and neck, and we have already done the detailed discussion about this. Now the main motto of this video presentation is we have to solve more and more MCQs regarding this theoretical part we have done. Now we want to solve more and more MCQs, but before that I want to give you some glimpse about the vessels of head and neck. So in vessels of head and neck we have read about the common carotid artery, internal carotid artery, external carotid artery, then the subclavian artery. So now this particular diagram, I hope you all remember this one. Okay, this is this is your favorite diagram from the vessels of head and neck. This is your arch of aorta. Then you can see you have ascending aorta and the descending aorta, and then there is one punching out left subclavian artery, then left common carotid artery, right common carotid artery, right subclavian artery, and then brachiocephalic artery. From the brachiocephalic artery you are having right common carotid artery and the right subclavian artery. Now coming to the cream, okay, how to learn this diagram. So there is something known as common carotid artery, right? And right common carotid artery, it arises from your brachiocephalic trunk, and for this I have already given you one password, that is your RBRAC. Right common carotid artery arises from brachiocephalic artery, and the left common carotid artery, it arises directly from arch of aorta. If you know this diagram now, you even don't need any kind of password. It is very easy. You can make out from arch of aorta, left subclavian artery is coming out, and the arch of aorta you have brachiocephalic artery coming out, and from brachiocephalic artery you are having right common carotid artery and right subclavian artery. Okay, so right common carotid artery is a branch of brachiocephalic artery, okay, RBRAC, and left subclavian artery left common carotid artery is directly coming out from arch of aorta as well as your left subclavian artery. So now it is clear. Now the another point that you have to know is that in the neck both arteries, it ascend upwards from the level of sternoclavicular joint, and to the level of this they have asked n number of times, okay, to the level of upper border of thyroid cartilage. Even in the NEET, even in AIMS, they have asked this question, and there are high chances that this question is have gone many times repetitions. So just know that to the level of upper border of thyroid cartilage at the upper border of C4, okay, where they divide into internal and external carotid artery. Okay, so in the neck both arteries ascend upwards from the level of sternoclavicular joint to the level of upper border of thyroid cartilage at the upper border of C4, where they divide or where they bifurcate into two parts, that is your internal and external carotid artery. So where is this artery bifurcating? It is at the upper border of your C4. Okay, so here 2 or 3 MCQs are there. Okay, right common carotid artery, it arises from brachiocephalic artery. Left common carotid artery, it arises directly from the arch of aorta. And in neck both arteries, it ascend upwards from the level of sternoclavicular joint to the level of upper border of your thyroid cartilage, and at the upper border of C4 they divide into internal as well as your external carotid artery. Okay, then you have to know something about that common carotid artery along with vagus nerve and internal jugular vein, it is enclosed by the carotid sheath. Okay, this is again one MCQ, and we will solve this. We have few sets of question where you can see the question MCQ and you can relate this. So common carotid artery along with the vagus nerve and the internal jugular vein, it is enclosed by the carotid sheath overlapped by anterior margin of your sternocleidomastoid. Okay, therefore carotid pulse, it can be felt along the anterior margin of your sternocleidomastoid muscle at the level of your laryngeal prominence. Okay, so how you can feel your carotid pulse. So because of this, the common carotid artery along with the vagus nerve and with your internal jugular vein, it is enclosed within the carotid sheath and it is overlapped by anterior margin of your sternocleidomastoid. Therefore the carotid pulse, it can be felt along the anterior margin of your sternocleidomastoid, and at which level? At the level of your laryngeal prominence. Okay, then then the next point is that common carotid artery, it can be compressed against anterior tubercle of transverse process of C6 vertebrae, which is also known as your carotid tubercle, and it is at the cricoid cartilage level. So these 4 or 5 points you just know about the common carotid artery, and this is we have already discussed this flow chart about the arch of aorta. You are having brachiocephalic, left common carotid and left subclavian artery. So left subclavian artery and left common carotid artery, it is directly coming from arch of aorta. From brachiocephalic, you are having external carotid and the internal carotid, and it is bifurcated at the level of upper border of C4. Okay. Then coming to the external carotid we have really done well in our WhatsApp discussion group. We have discussed about the anterior, posterior, medial and the terminal branches and the passwords. Like for anterior, you have ASLF, okay, anterior, A for anterior, S for superior thyroid, lingual and facial, and these are your anterior branches of your external carotid artery. So anterior branches, SLF, ASLF. A is your anterior, SLF is superior thyroid, lingual and your facial. Then for posterior, we made a password that is POP, posterior, P for posterior, and OP is your occipital and preauricular. Then for medial, we have made one password that is your MA, ascending pharyngeal, A for ascending pharyngeal, M for medial, and terminal we have TMS, that is your maxillary and superficial temporal. If you if you repeat this like 4 or 5 times, it will be on your tips. Like anterior, ASLF, leave anterior, ASLF, POP, MA, TMS. So A for anterior, okay, anterior you have SLF, that is your superior thyroid, lingual and facial. If you are repeating after me, trust me, you are going to learn it now only, now itself. So A for anterior, SLF is your superior thyroid, lingual and facial. POP, P for posterior, OP is your occipital and preauricular. Then you have MA, that is M for medial, A for ascending pharyngeal, and terminal for the last one is TMS, T for terminal, M for maxillary and S for superficial temporal. Now here 2 S are there, so don't get confused. Superior thyroid is your anterior branch and superficial temporal is your terminal branch. So this was about the arch of aorta. We have already discussed in detail in WhatsApp discussion group, so I'm just rushing. Okay. So then we discussed about, here I have put only about the anterior, okay. What is A there? A is your anterior branch of what? External carotid artery, okay. So first you have superior thyroid, then lingual, then your facial. So superior thyroid, just below the level of greater conua of hyoid bone, you can see the superior thyroid artery. And very, very important MCQ is, it is superficial to your external laryngeal nerve. Okay, it is superficial to your external laryngeal nerve. In WhatsApp discussion group, we have already discussed about the from the diagram, so it is very easy from there. So I'm just rushing because I want to do MCQs, more of MCQs here. Okay, so superficial to external laryngeal nerve. Then for lingual artery, it is opposite the tip of the greater conua of the hyoid bone, and the course is divided into 3 parts. First is your carotid triangle, second, which is very, very important, deep to hyoglossus, and third, it is also known as your arteria profunda linguae or deep lingual artery. Okay, and the carotid triangle, it is characteristic. There is one characteristic upward loop, and which is crossed by your hypoglossal nerve. Many times they have asked this MCQ. Okay, so it is the hypoglossal nerve. Second part, and the second course of your lingual artery, it is deep to the hyoglossus, and the third one is your known as also deep lingual artery. Then coming to the facial artery, then just above the tip of the greater conua of the hyoid bone, and it runs upwards first in the neck as cervical part and then on the face as the facial part. Then you have the branches, several cervical branches like ascending palatina, tonsillar, then submantle, and the glandular branches for the submandibular gland. Okay, then you have the facial branches. So this is about the facial. And what is A doing there? Because it is anterior branch of your ECA, okay, external carotid artery. Then coming to the internal carotid artery again it is divided into 4 parts: the cervical part, the petrous part, the cavernous part, and the cerebral part. So I'm not going into detail because we have already discussed about this. Okay, so just remember that internal carotid artery, it is cervical, petrous, cavernous, and cerebral part. Then coming to the subclavian artery, which is very, very important, the origin and the branches, again we have already discussed. So learn about the branches, learn about the course, and those 2 words are really, really important when we are discussing about the course of the subclavian artery, that is the axillary artery and the scalenus anterior muscle. Okay, so this is really important. So now coming to the main part of this video, that is your MCQ. Like, okay, first question if we see, let me just zoom in. Okay, I hope it is clear for all of you. Sorry. So if we see, the first question is like common carotid artery bifurcation is that. I emphasized in the WhatsApp discussion group also and even here also that common carotid artery, it bifurcates at the thyroid cartilage. Okay, common carotid artery, it ends by dividing into internal carotid artery and external carotid artery at the upper border of thyroid cartilage, and at which level? C4 level. Okay, then coming to the second question, they have asked common carotid artery, it divides at the level of, now you can answer this one because we have just now discussed this, it is at the superior border of the thyroid cartilage. Okay, upper border of the thyroid cartilage. Then coming to the third question, which structure can be felt at the lower part of medial border of sternocleidomastoid? Which one? Is it subclavian, it is common carotid, internal mammary, or maxillary artery? Just now we discussed also that carotid pulse can be felt. So it is common carotid artery. Yes, correct one. See, the carotid pulse, that is the common carotid artery, it can be felt along the anterior margin of sternocleidomastoid at the level of laryngeal prominence of the cricoid cartilage. Okay, so the answer here is your common carotid artery. So till now we have discussed 3 questions like common carotid artery, it bifurcates at thyroid cartilage, C4 level. Common carotid artery divides at the level of upper border of thyroid cartilage. Then which structure can you feel? Can you feel at the lower part of the medial border of sternocleidomastoid? Obviously common carotid artery. Then coming to the next question is like Cheshanik's tubercle is, what is that? Basically I told you about the carotid tubercle, right? The carotid tubercle, okay, see, a common carotid artery, it can be compressed against anterior tubercle of your transverse process of C6 vertebrae, okay, which is also known as your carotid tubercle, and it is at the level of the cricoid cartilage level. Okay, so next question is your common carotid artery palpated at, now you can tell me this answer. It can be palpated at the upper border of your cricoid cartilage. Okay, see, at C3 level you have hyoid bone, at C3 to C4 upper border of thyroid cartilage, bifurcation of your common carotid artery, then C4 to C5 you have level of the thyroid cartilage, and C6 is your cricoid cartilage. Okay, cricoid cartilage, that is your common carotid artery. It is palpated at this level against the prominent transverse process of C6. Okay, then next coming to more MCQs, internal carotid artery, it crosses which one? Sigmoid sinus, straight sinus, cavernous sinus, or sagittal sinus? Obviously, it is your cavernous part of, see, the cavernous part of your internal carotid artery. Okay, it runs through the medial wall of cavernous sinus. So the answer is cavernous sinus. Then coming to the next question is, which part of ICA does not give any branch? Okay, in WhatsApp discussion group we have already discussed about ICA, okay, the branches. So you know the various branches like cervical branches, petrous, cavernous and cerebral. So cerebral, what are the branches of the cerebral? We have learnt about the ophthalmic, anterior cerebral, middle cerebral, posterior communicating and anterior choroidal. Then cavernous, you have cavernous, meningeal, superior and inferior hypophyseal. Then from the petrous you have carotico-tympanic branch and the pterygoid branch. But cervical branch of your ICA, it is not giving any kind of branch, okay, it is not having any branches. So here the answer is your cervical. Then coming to next question, terminal branches of internal carotid artery are all except. Now this one you can answer, like you have anterior cerebral artery, middle cerebral artery, posterior communicating artery and cavernous artery. So basically terminal branches of are all except, you can go for D, like cavernous artery. Basically even this question they have not framed well. See, internal carotid artery, it is having two terminal branches, okay, anterior cerebral and middle cerebral. Okay, middle cerebral is your larger terminal. So the examiner, I think they want to know the branches of terminal or the cerebral part of ICA, not the terminal branches, okay. So in that case, in this scenario, the answer can be more prominently, more appropriately your D, cavernous artery, okay. So now next, coming to the next question, which is not a branch, that is done, okay. Then next is your, which is not a branch of cavernous part of internal carotid artery. They are asking cavernous branch, inferior hypophyseal, meningeal and ophthalmic. So here the answer is D, ophthalmic artery. It is not a branch of cavernous part of internal carotid artery. What are the branches of cavernous? You have cavernous, meningeal, superior and inferior hypophyseal. And then ophthalmic is a branch of cerebral part. Okay, so it should be on your tip. See, cervical part of your ICA is not giving any branches. Petrous is having carotico-tympanic branch, pterygoid branch, and cavernous part is having your cavernous, meningeal, superior and inferior hypophyseal, and cerebral part is having ophthalmic, anterior cerebral, middle cerebral, posterior communicating and anterior choroidal. Okay, so ophthalmic is a branch of cerebral part of your ICA. Okay, not the cavernous one. Then next question is, your anterior 2/3 of the tongue develops from. I think this all of you can answer. That is your first branchial arch. So this was your first set of MCQ which we have discussed now, and this is really a good quotation. Success is not final, failure is not fatal. It is the courage to continue which counts. Okay. So now coming to the next set of question. Okay, let me zoom in. So the next part is posterior communicating artery is branch of. Now you have to answer this whether it is ICA, ECA, middle cerebral artery or posterior cerebral artery. Obviously it is ICA, internal carotid artery. And which internal carotid artery? The branch, that is your cerebral one. Cerebral one is a cerebral one. It is having ophthalmic, anterior cerebral, middle cerebral, posterior communicating and the anterior choroidal. So posterior communicating is a branch of cerebral part of your ICA. Okay. Then coming to next question, anterior choroidal artery is a branch of which one? Anterior choroidal. Obviously ICA, internal carotid artery. And which part of ICA? Cerebral one. Okay. I think cerebral one, it is like you will learn it now only, like cerebral. Okay, ophthalmic, anterior cerebral, middle cerebral, posterior communicating and anterior choroidal. Okay. Then next question is, ophthalmic artery is a branch of which part of ICA? Cervical, petrous, cavernous or cerebral one? Very, very easy. Ophthalmic artery is a branch of cerebral part of ICA. Then next question, not a branch of ophthalmic artery. I want you guys to learn more about the ophthalmic artery in detail, okay? So not a branch of ophthalmic artery. I'm leaving this question for you all because I want you to go in detail about the ophthalmic artery, okay? About the branches of ophthalmic artery, like central artery of retina, then lacrimal artery, then meningeal artery, then ciliary, posterior ethmoidal, medial palpebral, supratrochlear, supraorbital, and the dorsal and the muscular. But here the answer is your superficial temporal artery, okay? This is superficial temporal artery, is not your branch of ophthalmic artery. Which one? It is a branch of ECA, and ECA may be, it is a branch of your terminal one, superficial temporal artery, okay? Then central artery of retina is a branch of ophthalmic artery, correct? Ophthalmic artery, I really want you guys to go in detail and learn about all the branches of ophthalmic artery, okay? Then next question is your supraorbital and supratrochlear arteries are branches of, this one is really easy, just answer this one, supratrochlear and supraorbital ophthalmic artery, correct? Then which of the following is wrong regarding ophthalmic artery? Present in dura along with the optic nerve, supplies anterior ethmoidal sinus artery of retina, leaves orbit through inferior orbital fissure. The answer is, which is wrong, they have asked. See, ophthalmic artery doesn't leave through inferior orbital fissure. It terminates near the medial angle of eye by dividing into supratrochlear and dorsal nasal branches, okay? So other options are obviously correct. So the wrong answer is your D1. Okay, it doesn't leave through the inferior orbital fissure. Then coming to the next question, all of the following are branches of external carotid artery except, now this one you can answer. Lingual artery is a branch of external carotid artery and it is anterior one. Superior thyroid, anterior one. Ascending pharyngeal artery, remember MA, so medial one is your ascending pharyngeal artery. Transverse cervical artery is not a branch of your external carotid artery, okay? So the wrong answer is, the exception is your transverse cervical artery. Then your next question is maxillary artery is a branch, branch of facial, internal carotid, no, facial, no, common carotid or terminal branch of external carotid. It is a terminal branch of your ECA, okay? Ascending pharyngeal artery is a branch of, obviously this one you have mastered already, this is a branch of your external carotid artery. Now, okay, once again there is one quotation, so believe you can and you are halfway there, okay? So first thing is that you have to believe in yourself that yes, you can do it. And never ever stop dreaming. Keep on dreaming. Like, dream is something which will make you to work harder, and obviously the hardest, and then you are going to strive no matter what, okay? Okay, so now next set of question. Then here the next question is exposure of left subclavian artery by supraclavicular approach doesn't require cutting off A. Sternocleidomastoid, scalenius anterior, scalenius medius, and omohyoid. Just see this question, like how beautifully they have framed this one. Okay, you see, exposure of left subclavian artery by supraclavicular doesn't require cutting off what? Cutting off. It is not requiring sternocleidomastoid, scalenius anterior, scalenius medius, or scalenius medius of this one. So it is scalenius medius. See, scalenius anterior muscle, it is cut to approach the subclavian artery, okay, which is your second part. However, the scalenius medius, it need not to be divided as it lies posterior inferior to the subclavian artery, okay. So platysma, sternocleidomastoid, sternothyroid, and sternohyoid muscle, these are anterior to the first part, but the scalenius anterior along with your sternocleidomastoid and the platysma muscle, it is anterior to second part. and subclavius along with the SCM and the platysma, it is anterior to the third part of the subclavian artery. So the inferior belly of the omohyoid, it is superior, and scalenus medius is posterior to third part of your subclavian artery. So here the answer is your scalenus medius. Okay, exposure of left subclavian artery by supraclavicular approach, it doesn't require cutting of your scalenus medius. Okay, then the branches of first part of subclavian artery are all except all vertebral artery, even thyrocervical also, internal thoracic also, and costocervical also. But they have asked about the first part. Okay, so you can, if you want, you can go with the costocervical as it arises from the second part of the subclavian artery on the right side, but from the first part on the left side. So here even you cannot go for costocervical, right? But if you have to choose one, then you can go with the D. Okay, so next question is, the vertebral artery traverses all of the following except, you have to know the basic first. Vertebral artery traverses through the vertebral triangle, foramina transversaria of the upper 6 cervical vertebrae. Okay, suboccipital triangle, posterior atlanto-occipital membrane, and the vertebral canal, and then it pierces the dura mater and the arachnoid and passes through the foramen magnum to enter the posterior cranial fossa. Okay, so the answer is your C, intervertebral foramen. Okay, the next question is, your vertebral artery passes through the foramen of transverse process of all except 7 cervical vertebrae. Okay, then true about vertebral artery. A branch of thyrocervical, no. Enters, yes, the B one, it is true. It enters skull through the foramen magnum. Okay, so these are few MCQs that we have done. We have done from your this part, the vessels of head and neck, and there are more we will do in the another set of the MCQs. Okay, these are the few MCQs. Just you have to know the basic first. What is common carotid artery, how it is arriving from the arch of aorta, at which level it is bifurcating and dividing into internal and the external carotid artery, then the branches of your external carotid artery, then branches of your internal carotid artery, which part is not dividing further, which is not having any branches of the internal carotid artery, that is your cervical one. Then petrous is again divided, then cavernous, meningeal superior and inferior hypophyseal. Then cerebral, it is having ophthalmic part, anterior cerebral, middle cerebral, posterior communicating and anterior choroidal. Then learn about the subclavian artery. So if you know this much, it is more than sufficient for your vessels of head and neck, and you can see it's really very easy to solve the MCQs once you know the concepts or once you know the facts. Okay, this is coming from here, this is coming from there, this is the first part of the branch. So, and if you want to join the WhatsApp discussion group, you can contact at this number and we will add you in the discussion group. Basically there are 6 WhatsApp discussion groups and 6 WhatsApp discussion group, and each group is having its own benefits, so you can go with the details and you can join all the WhatsApp discussion groups. Okay, keep learning. And this quotation, again there is one quotation, just go through this. No matter what you are going through, there's a light at the end of the tunnel, and believe. First thing you have to do is believe. Believe that yes, you can do, and you can do, because you need only one seat, and whichever seat you are dreaming of, you can get it. Okay, chalo bye, take care and keep learning.